through February. What's going on with COVID in the country? Cases continue to come down. So it looked like we've gotten through our post-holiday surge, and could even call it a wave. And so that's good news. Here locally, North Carolina, our cases are coming down too. If you're a daily follower of the COVID dashboard here in North Carolina, you'll see a big spike in cases yesterday. That's actually due to late reporting by one testing organization who didn't get their reports in from the last week before that. So they just tossed it all in on one day at the state. So if you want to control for those wide swings and variations from reporting delays, you can look on the COVID dashboard now. There's another way of examining positive tests, and that's by the day of specimen submission, rather than by the day of reporting to the state. And so that smooths that out a little bit. Here in Forsyth County, our cases are coming down as well. Slowly. There's still a lot of COVID out there. So if you look at the wave, and you look at where we are on the wave now, and then draw a line straight back to the upturn of the wave in the late fall, we're about where we were right before Thanksgiving. And so there's still a fair amount of COVID out there. I'm a little bit concerned that people are starting to let down their guard and not paying attention to the details, which are fairly simple, of wearing a mask, social distancing, avoiding parties, and social get-togethers, and washing their hands. A lot of this is just based on personal observations and things that I'm hearing about people who are testing positive, and how the test became positive. So even though vaccines are going on, we still need to do that. And it's more important than ever, actually, to pay attention to those details, particularly with masking. And why is it so important now, as compared to even other times, is because of the variants that are coming around. So we've had, since our last briefing last week, some new information yet with the variants. The first one is that, for the most part, vaccines do cover them. The South African variant, a little bit less so, and the Brazilian variant probably also a little bit less so. The UK variant seems to be fairly well covered by them. The other things we found out with the South African virus is that some people are getting reinfected who got COVID early in the pandemic from the wild-type virus. And now the variant's coming around and they get reinfected. It does seem, though, like reinfection, the disease is less severe and they're less likely to be hospitalized for the most part. And not everyone's getting reinfected. So it seems like the immunity provided by natural infection or vaccine for the South African variant isn't quite as robust. But the question we still have to answer, is it robust enough? Will it slow the virus down enough so that if you do some other things, such as social distancing and masking, it might be enough to curtail transmission. So those studies are ongoing. Here in the United States, we're finding more variants than we always thought we would, and most of them are the B.1.1.7, the so-called UK variant, and we're still trying to figure out how much more transmissible it might actually be in the United States. We need more sequencing of the virus available in order to identify these. So are there variants here in North Carolina? Well, yeah, we found a couple. There's probably more than what we found. It wouldn't surprise me. The thing is that when you look at these mutations from these variants, the more virus out there and the more times that the virus replicates in a person, the more likely a mutation will occur. So if you have 10 billion viral particles, the chances of a mutation occurring in a 1 in a billion times is going to be higher if you only have 1 billion virus particles. So, Tony Fauci was saying the other day, the way to keep more mutations from occurring is to get viral transmission down as much as we can. And the way we can keep it down is the same way we've been doing it all along, plus getting vaccinated. And I know there's still a lot more people out there who want to be vaccinated than who's been able to yet. I understand that, so I'm not going to get out the whip and flog people to go get vaccinated when the vaccine's not out there. But when it is available to you, go out and get it. And if we can get transmission down, we can limit the number of new mutations that occur, and then we won't have mutations on top of mutations. And that's the main concern. Well, the variants out there now, we might be able to work with and control. If there are even more mutations on top of it, it might really be able to get around vaccines or immunity. So we want to keep no more mutations. That needs to be our mantra. And I just told you how to do that as a society. So the companies making the vaccines are already working on tweaking their vaccines to cover some of these variants. And I suspect by early fall, late summer, those will be out there. And if we need to, we can get booster shots at that time. So another round of vaccinations for the country, potentially in our future, so that we can cover these variants. So a little bit on that. Vaccine update, we're getting more and more people vaccinated. I get the numbers for Forsyth County on Friday morning, so, but we've probably had over 50,000 now in Forsyth County. And across the state, we're doing pretty well. As of last week, we were number 3 in the state by county, and and so that's great. The county's working hard at the fairgrounds, and our health systems are working hard and ramping up the number of vaccines we're giving. We are still, excuse me, we're still limited by the number of vaccines we get from the state, and the state is limited by the number they get from the federal government. So that is still a limiting factor. I'm seeing a little bit of optimism that in 3 weeks or so that's going to improve. The companies making the vaccines are working on their production lines and doing even simple things like using bigger vials and giving more doses per vial. Because that if you fill more in each one, then that's less boxes and less time for the company, so that'll make more vaccine. New vaccines coming out on the front, probably AstraZeneca. Later in the month here, we'll have an adenovirus vectored vaccine that has about 80-some% protection, depending on which study you look at, and actually even for the South African variant, really reduces hospitalization and death. So even though the efficacy is a little less for the South African, it does protect people from the more severe aspects of the disease. And then we have Novarex's vaccine, which is going to come out in small numbers initially. Both of these are a little easier to use. We don't have to have the severe refrigeration requirements and freezers, and then AstraZeneca's may be able to give in just one dose, and that'll help with the logistics of getting vaccinated. It's funny, the questions that I get asked about vaccine, all of them are great ones. The one that's come up this week is what about taking ibuprofen or acetaminophen, otherwise known as Motrin or Tylenol, in and around the vaccine? Will that reduce the efficacy? No, it won't. If you take it right before you get the vaccine, we don't really have data, but we have data in kids with other vaccines that it doesn't really affect the efficacy of those. Personally, what I did when I got vaccinated is that I took the ibuprofen before I went to bed that night that I got the vaccine. And that helped with the soreness, and maybe it kept me from getting the fever I otherwise would have gotten because I didn't get one. I wouldn't take it before getting vaccinated. There's really no reason to. The needle's sharp and it's small and you hardly even feel it when it goes in. It's the soreness afterwards that you can take the ibuprofen or the acetaminophen for. And you don't need to worry about it reducing vaccine efficacy. I still get a lot of questions about pregnancy. And yes, I still think, personally, I think it's safe in pregnancy. Definitely safe for breastfeeding, and the American College of Obstetrics and Gynecology haven't changed their opinion on that either. So with the new vaccines that come out, we'll talk about the individual risks for pregnancy or breastfeeding with those, but I don't see any on the horizon right now for those vaccines either. Masking. Lots of questions about double masking. And I know it's kind of hit the papers because some experts recommend double masking and some experts say, well. So there's two things about this. One is you have to remember is that we wear masks to protect other people from our respiratory droplets, and cloth masks work well for that. But you need to get a good cloth mask. You want one with at least two layers, and it has to be a tight weave. So kind of like the nice bed sheets type weave rather than the cheap bed sheets type weave. And that increases the efficacy of the cloth mask. If you put fillers in it in between them, it makes it even higher. So if you have a really good mask and you wear it correctly, in other words, over the nose as well as over the mouth, wearing it below the nose doesn't work, then you probably are fine with the single cloth mask. So that's the one thing to remember. The thing is that if you're really into wanting to protect yourself from other people, then you need a little bit of a different kind of mask. And in the medical world, to protect us from people who have contagious diseases, we use either surgical masks or N95 masks. So how do we do it in the hospital? We see lots of COVID patients in the hospital. And our masking recommendations have not really changed since last spring. We wear surgical masks, tight-fitting surgical masks. For seeing patients with COVID, we sometimes wear N95 masks, particularly if we're doing a procedure on someone that generates a lot of respiratory aerosols. And then we use N95 masks, but otherwise surgical masks are okay. And we've been doing that from the beginning, and we haven't really had a lot of people falling out of the sky on us with getting COVID from their patients just because of the surgical mask. The other thing that we do in healthcare is we wear face shields, and the face shields are over the eyes. Because you can get infected with COVID through the eye. You get it on the eye and then it comes down through the tear duct. It's not like it goes in the eye like some horror movie. It comes through the tear duct and that gets into your nose from there. But we in healthcare are a lot closer to our patients. We're examining them, looking in their mouths and stuff when we're doing our physical exams. And so I don't really think face shields are necessary for the general public to protect their eyes or goggles. I think, I'm going to stick with a really good, tight-knit, weaved, double-lined cloth mask myself. I don't anticipate the Centers for Disease Control in the near future changing their guidance on the type of mask to use. I know they'd like to study it and see if double masking really makes a difference for protection of people. But we find in healthcare, and have known for a long time, that it's the things about that we do in taking the mask off and putting the mask on, and the touching of the face and the other things at that time, that are more of a risk than the kind of mask that you have yourself. And so, it's important that if you're going to take your mask off, you should wash your hands or hand sanitize before you get your hands up there in or near your mask. So I think more attention to detail with masking is important and a good idea, but I'm not ready to start saying everyone should be double masking. So a little bit about schools. There are more school districts now that have kids back in classes and in person. I think that's a good idea. We have a fair amount of information now that kids really need that in-person education, and that learning is better, and that socialization and all those other things that are important to our kids in schools is better when they're in person. And we also know that if done with the appropriate safety measures in place, that transmission in schools is very uncommon. The social events surrounding schools sometimes can be a problem. The after-school get-togethers, some of the athletic programs and such, but the school itself is not the issue. So that's why our governor in North Carolina came out this week and recommended that school districts offer in-person classroom teaching. It's not a mandate, but give the option so that for people who want to do that, it's available to them. And I agree with that. Get asked a lot, when's the state going to move into a less restrictive phase? Right now we're in I think you call it a modified lockdown, where we have a curfew at 10 o'clock and bars and restaurants need to close, and we're supposed to be off the streets. I don't see that changing for a while, actually. I think particularly with the variants that people are worried about, I don't see our phase changing. So right now for vaccination, we're still vaccinating anyone over the age of 65 and healthcare workers. So when are we going to move into the next phase of vaccination where frontline workers such as teachers, grocery store workers, people in retail, firemen, policemen, so on and so forth can get vaccinated? Well, when we have enough vaccine, I think we will move into that. Right now, the vaccine supply is so limited that just getting the over 65 people, we're still in the process of doing that. And there's still a lot of people with appointments going out weeks, if not months, for that. So hopefully by the end of the month, and we're already on February 4th, and February is a short month. So hopefully by the end of the month we'll be doing that. Lastly, this weekend, Super Bowl. This is not a year for big Super Bowl parties. This is not a year for even small Super Bowl parties. This is a year for small, intimate viewing of Super Bowls, and getting together with your friends through social networks and virtually while you're watching the Super Bowl. You can still have all the fun Super Bowl food, and you can still watch the commercials and everything. And I'm not just saying this because I'm a Packer fan. We just have to really toe to it this year for the Super Bowl. Looking ahead at the weather, I don't see it being a wonderful weekend for having an outdoor viewing. So no inside Super Bowl events, please. So with that, I think I covered all the points that I wanted to this morning, so I'll open it up for questions.
Dr. Ohl, we had a viewer email us with a question that we didn't have the answer to, so I'm going to pose it to you. He says that he and his wife contracted the virus in early January, and they were trying to schedule an appointment for a vaccine. So they were wondering how long they needed to wait after they, tested negative before they could receive their vaccination.
Yeah, so if you got COVID, and yeah, I get a lot of those because I got COVID around the holidays. When can I get my vaccine? So the official guidance is you can get vaccinated as soon as you feel better, as soon as the symptoms have gone away. The CDC and myself, though, says, well, since you just got COVID, and you're more likely than not have antibodies from getting that COVID, and those antibodies are going to be around a while. If you want to wait and let other people get in line in front of you to get the vaccine, that's fine. And that's a polite thing to do for other people because you kind of got vaccinated the hard way. I wouldn't wait more than 3 months, though, to start the series after having gotten COVID. Interestingly, there was just a study that I saw this week that people who've had COVID may only need to get one shot afterwards. Now, that's not our official recommendation yet, but if you think about it, having COVID's like getting the first shot, right? As I said, vaccinated the hard way, and then you get your other shot as a booster. So we'll see if the recommendation changes on that. Right now, we're still technically giving 2 shots, even if you've had COVID before. So one thing I'm going to take a little bit of a license to talk about too is I'm getting a lot of questions that I've gotten vaccinated, so I gotta get out of quarantine free card, right? Or I can travel, or I have a license to be normal again, right? No, that's not the case. And if you've been vaccinated, you still have to mask. You still have to personally distance. You still have to avoid social interaction, and you still have to keep washing your hands. And the reason why. One is that vaccination's not 100%. So even with 95% efficacy of a vaccine, that means that 5% of people still will get COVID afterwards. So it may not be as severe, and you may not have to be hospitalized if you get it, but you could still get it. And that's still a bad thing, is getting COVID. So now, I don't know, some people think 5%, I can live with that risk, or 5%, ooh, that sounds too high for me. But that's one of the reasons why we still have to be getting it. The other is that vaccine efficacy may not be quite as high in certain groups, particularly if you're immunocompromised or have a lot of other underlying illnesses. The second big reason is that we are still trying to sort out whether or not you can get transiently colonized with COVID even though you've been vaccinated, not get sick with it, but transmit it to other people. We only have one study that was just published from England this week that says that transmission is reduced if you've been vaccinated, but it was not reduced 100%. There were still people who were getting colonized with COVID. They didn't get sick, but they were getting colonized. Now we have to find out whether they're actually transmitting it to other people. So because of those two things, we're going to have to kind of still be modifying what we do. to tell you the truth, I haven't really changed what I'm doing much at all. I don't go to restaurants. I avoid social interactions with friends and family, not in my own household. And I haven't really changed, even though I've been vaccinated. I still mask, I still do those things. So what I was thinking of doing is for next week, everyone out there can submit their questions. And I'll phrase it as this. If I've been vaccinated, what would you do, Dr. Ohl? And you can give me a scenario like, I want to visit my grandkids, or I'd like to travel to Fiji, or I'd like to, whatever it is that you think you might want to do just because you're vaccinated, ask me that question. And we'll go through all of the scenarios, because there's tons of them out there. What would I feel comfortable doing, and what should I think people should do if they've been vaccinated? And we'll spend a lot of time talking about that next week.
Have there been any studies yet on children and the vaccination? I know that at first there were not, and I didn't know if anyone had started.
There's one that's gotten started for children over the age of 12. It's been somewhat slow to enroll, but yeah, there's one ongoing. Under 12, I don't think yet there have been, but there are plans to do so.
There's been you mentioned earlier about schools and your recommendation that schools are safe to go back to session. The educators, the teaching community, there's been a little pushback. What would you have to say to teachers who are still fearful?
Yeah, well, I understand why they might be fearful, but what they have to understand is that the risk in the school itself is actually lower than a lot of the other activities they may be doing in their life. If the safety measures are in place. Some of that hesitancy comes from kind of what I call the standing on the high dive phenomena, where the longer you stand on the high dive, the scarier it seems to jump in. And so there's some psychology behind it. And I'm not dismissing concerns, but I think if you look at the risk and benefit ratio, it's safe for them to go back. The thing is that there's been a lot of people out there who are public servants who have continued to work, and for those people, I mean, the fear factors, for the most part, has gone away, because they know what to do and how to do it, and how to stay safe. And really, I think, teachers, they're also public servants in a way, and they should be treated like that. They're extremely important members of our society. Arguably, maybe there's no one else out there more important than a teacher. I mean, these are for our kids, and we should pay them what they deserve. And they are, after all, public servants. People say, "Well, I didn't sign up to be exposed to COVID." I mean, none of us did. I mean, our whole society is being exposed to COVID. So, no, none of us signed up for this, but. That's how I feel about it.
Lastly, Dr. Ohl, it's been almost a year, and our frontline workers have been dealing with this for quite some time. How do you feel like the staff is holding up physically and mentally dealing with the challenges of COVID?
Yeah, that's a real good question. So how are we all holding up physically and mentally? Well, I think you could ask that of anyone out there. I mean, our whole society and all our communities have been dealing with this for a year now. And every now and then somebody gets grouchy. Somebody needs to unload. You've probably seen it in your own personal lives, either at home or in the workplace. And it's sort of a natural thing. So we see that, in our healthcare settings as well. And it's okay to rely on your friends and make a phone call and unload and let people know, how you feel and get it off your chest and get it out there. People are tired, and again, I know it from healthcare. Our docs and our nurses and everyone who works in our healthcare settings is kind of tired. But yet, you guys are probably tired too out there in media, right? You've been slogging through, and everything you do in times of COVID, everything you do is just a little bit harder. And it can be fatiguing, so I understand that. I think that one of the ways to help with this is to realize that, there is an endpoint to this. With all the variants around, the endpoint might come a little later and a little bit slower, but it's still going to end. And we're going to get through this. I'm pretty optimistic about it, actually. I think that, and I've said it before, by the time this summer comes around, we'll start seeing where the end of the tunnel is. And then by the end of the year, things are going to seem a lot normal to us. So hang in there.
Dr. Ohl, we've got one question. Just your thoughts on some of the other states who are saving some doses for very vulnerable people under 65, those who've had organ transplants or undergone cancer treatments.
Yeah. Some states are saving doses for some of our very vulnerable persons, people who have cancer or immunocompromised, and I think we'll have to see how North Carolina does it with phase 3. Whenever you're doing prioritization for vaccine, there's always two considerations. One consideration is who's at risk the most, and if you vaccinate somebody, who is more likely, if they get it, to reduce transmission to other people. And then the other is, how do you protect the individual who needs that protection the most? So, and that's a balancing act for public health. But yeah, I think that saving some doses for that group would be important, and we'll have to see how that goes in phase 3, because we don't want to forget about them. But right now, if you look at the overall health of the general population, the over 65 group is a pretty vulnerable group, and there's a lot of those people. And that's why we've prioritized them right now. So, good of the many, in a way.